I'd like to talk to you a little bit about MRI scans. I have a lot of people that come in and we talk about imaging, and we do have a wonderful technology that is able to look at the spine in ways that we couldn't look at the spine 15 or 20 years ago. Now, MRI scan is relatively new when we think about medical care. It's really been used in clinical practice, again, since the early 90s. What I want to emphasize to people is don't freak out about your MRI scan. An MRI scan does not show us pain. As one of my early professors told me, it's like a picture of a telephone. You don't know if it's ringing or not. And what that means is that everybody's spine changes over the years. So when scans first came out, we were seeing arthritis, disc bulging, other changes on a scan that we would call degenerative disc disease. And people were getting surgery to try and make them feel better. Unfortunately, we think we were treating the scan more than the patient because the surgical outcomes weren't that good. So some very smart people decided to do some studies where they scanned people without any pain. And what they got was fairly astounding. Basically, everybody has some abnormalities. They took different age groups, beginning in teenagers, moving up past the age of 60. In teens, it wasn't uncommon to see these abnormalities in about 15 to 20% of people below the age of 20. As you progressed in age each decade, those numbers got higher. So I'm 48 right now. In my age group between 40 and 50, there's about a 70% chance of seeing disc bulges, arthritis, even disc herniations or pretty advanced arthritis called stenosis in about 70% of those patients. And once you get over 50, there's usually something there. So what I want to emphasize is you probably shouldn't read your MRI report because it'll scare the heck out of you. But talk to your doctor about what does the MRI mean in the context of my symptoms and in my physical exam, because again, really we want to treat the patient, we don't want to treat the scan. So if we see something that lines up with your pain complaints and your physical exam on the MRI, then we can really talk about what treatment makes sense. But I just caution folks because they'll tell me all the time, let's get an MRI so we can see what the problem is. And sometimes the MRI doesn't give us the answers that we hope for. But many times it tells us what we don't have to deal with. We don't have to deal with a tumor or a fracture or something bad back there. So we as physicians, sometimes it gives us the opportunity to reassure you